Hello everybody, welcome to BD Nurse E-Corner channel. So as I told you, followed by the phlebitis, after you analyze which grade the patient is in, there are certain guidelines according to the Center for Disease and Control and prevention of all the communicable diseases. You have certain guidelines which prevents the formation of phlebitis or as well, which is also initiating what to be done in case of a phlebitis. So coming to the introductory part, phlebitis is a common complication which is purely due to peripheral IV catheter use. So as a result, due to the improper techniques or due to aseptic precautions not followed, or might be the right size and the area where the cannula has been chosen, everything is being altered by the staff nurse, which causes the patient to put into a complication after IV insertion, which we call it as phlebitis. So here the Centers for Disease and Control Prevention plays a major role in the management as well as identification and prevention of phlebitis. You may all think now what to be done, madam, what can I do, and as a student nurse what I'm supposed to do and not to do. Don't worry, the CDC guidelines have given you certain checklist where you will be preparing yourself just before the procedure, during procedure and after procedure. The do's and don'ts during IV insertion. So the first step in prevention and monitoring according to CDC guidelines is your hand wash, or you call it as the hand hygiene. So it can be either use of soap and water or the antimicrobial solutions with water, or might be it is like just a plain alcohol swab. It is the alcohol hand rub. So here we are going to do the proper hand washing steps according to the WHO guidelines. We will be having the 7 steps of hand wash followed by the 5 moments of hand hygiene whenever you do any sort of invasive procedures. So here this is mostly insisted on a patient during IV insertion, just before as well as after insertion, as well as replacing, accessing and repairing, or you're doing your daily dressing change in the IV catheters during all the times whenever you go and touch the patient. Just follow a strict hand hygiene technique. The second important thing is that you have to follow the aseptic techniques. So aseptic techniques, as you can see in this picture, the sister is actually doing antimicrobial decontamination of the skin by using the alcohol swab. So here she is also wearing the glove. So here you can see there is a strict aseptic technique which is followed, and always this aseptic technique is being done by the usage of 0.5% chlorhexidine with alcohol just before catheter insertion, as well as if you want to change the catheter side dressings, transparent dressings, during that time also at the access site you can do the skin decontamination. Next, the third important guideline which is given by the CDC is that skin antiseptics. So just before insertion, see that the antiseptic is allowed completely air dry. So in some of the cases you can see the staff nurse is too pretty busy and they do the skin decontamination with the use of the alcohol hand rub or might be the chlorhexidine, but still they are not allowing it to dry. There should be some contact time and it should have been tried, only then the antimicrobial action would have been started. So if you're not allowing it to dry or the contact time is not given, what happens is during the insertion along with the IV line, that is the cannula, you can see some sort of the medications are also being infiltrated, which may be the major cause for developing phlebitis. As well, do not touch the insertion site after disinfection. You may see this one in the practical scenarios, like they put the tourniquet, all the sterile supplies are being kept near the patient, and the skin decontamination is done thoroughly. But just before insertion, again, do not palpate for the vein. So you can do all the palpation of the veins doing the tapping technique, and you can ask the patient to open the hands and close the palm just for the perfusion to increase, and then hold the hand fist tightly. But then after you have decided that this is the line I'm going to approach, do not again rub with the plain hand, or it might be the gloved hand, after doing the disinfection. The fourth important CDC guidelines which they are given is that catheter site selection. So this is really commonly seen in many of the growing hospitals, as well as you can see that the new nurses which are nearly tackling with the patient. So always keep in mind whenever you go for IV insertion, there is a strict rule or principle to be followed, is that one prick, one at a time. That is, one time you're going to approach the patient and you're going to give only one prick, not going to give for more trials. Because whenever you do the n number of insertions for one setting, you are actually thrombolizing that particular thrombosing that particular area. So what happens is that in case of emergency, all the peripheral access are now failed. So that's the reason you go and select the vein according to the patient, according to the individual. Always choose the upper extremity rather than the lower extremity, and see that you are not going to the folds where the patient is bending, or where the patient is not having a good access, or you can see if it is a slender vein or just a minute smaller branch. Please avoid those sites. So here you, as a student nurse, think before you prick, and just see the principles, whether it is followed, whether it's a big vein, whether the catheter size is according to the vein size of the patient. So likewise you are going to decide, and then you prick the patient. But see that the tip of the catheter is not going in between the branches, rather than it is in situ onto the particular line. Then the fifth important guideline which is given by the CDC is that catheter insertion. So always use the glove. Not ever do the shortcuts. Some nurses, when I go into the ward, they say that madam, I am unable to access the line, so I am not able to feel the vein. Or might be the staff nurse feels that if I am in a bare handed, I am easily getting the line. It's not at all like that. So after you wear the glove, immediately you have to again do the skin rub, so that the glove and the skin of the person who is going to apply the cannula will be very close with each other, and you can easily palpate the vein. And then avoid femoral veins, because only when it is necessary you are going to go for femoral vein. Otherwise do not puncture the femoral vein. The sixth important guideline which is given by CDC is that catheter placement. Always use a sterile dressing. So in this picture you can see the sterile dressing, tegaderm dressing is being applied, where it is transparent, that is you can see through. So whether there is a inflammation, or whether there is a site of redness or swelling or edema or any infiltration. So this is actually guiding you, or this is actually showing us whether the patient is in any of the grades of phlebitis. So this is keeping the patient in track to prevent the phlebitis. So always see that you're going to apply a non-irritant transparent dressing, which is very easy to access for the patient, for the nurse, as well as very comfortable to the patient. Then you have the seventh important guideline is changing of dressings. So in this picture you can see there is a cannula inserted with the transparent dressing, followed by the date and time of the patient. In some of the hospitals they also write the name of the patient. So the dressing need to be changed every 5 to 7 days if it is a transparent dressing. And if it is a gauze dressing, you are going to change the dressing of the IV side every 2 days. Or might be in cases where it is soiled, or where there is a looseness, or there is a dampness at the site, immediately we need to change the dressing. So keep in mind the dressing at the IV site according to the usage and according to the number of soil at that particular site. Then we will be planning whether the dressing needs to be changed or not. Then the next important category which we go in for prevention of IV phlebitis is that it is the site inspection. So in site inspection, you're going to see or you're going to inspect the particular site of insertion. So here you can see whether there is redness, whether there is any swelling, whether there is pain when the patient, when you're touching the IV line, or whenever you try to open the adapter and fix the medications inside through the IV line. So that also will be giving us a aided tool of phlebitis. So checking the site regularly on shift basis. Catheter placement will play a major role in maintenance and monitoring of phlebitis. So you have to see that it, as per the hospital policy, the catheter line is being changed every 72 hours, or in case if there is no chance of phlebitis at least after 96 hours, we have to change the IV line. And immediately after removal of the catheter, just inspect for the phlebitis and according to the grade start the management. Last but not the least, you have three more. In that, the disinfection of the hub whenever you open the IV line, either with alcohol swab or might be chlorhexidine swabs. And the 11th important thing is that IV lines maintenance in a closed system whenever possible. Always use the needleless connectors and ensure that there is proper disinfection before use. So here I have given the catheter size and the flow rates, and according to the size of the catheter or according to the plan of infusion, you are going to choose the catheter, as well according to the size of the vein diameter also we choose the catheter. Last but not the least, documentation and monitoring. Yes, you may ask me what to document. So document the date of insertion, the time of insertion, the site where we have inserted, the catheter selection, that is the size of the catheter, whether it is a Venflon, whether it is a SV set, and then inspect the findings. Monitor in case of any complication. And if it is like you have inserted the IV line yesterday and today you are being posted in the afternoon shift, so it's our duty to monitor continuously for early signs and symptoms of complication. Next, I have a small model on how they maintain the cannula. So this is a vascular access device form which I have downloaded from the net source. So here they are having the patient unique identifier number. In some of the hospitals, the family name, that is a surname given by the exact patient name, the address, and the date of birth, what sex they belong, whether male or female. Then you have the insertion, IV insertion details, that is on which date we have done, at what time, what is the site of the IV insertion, what size of the cannula we have inserted, what was the need for inserting the IV line, and the number of attempts, like whether it is a single attempt or double attempt or might be n number of attempts, and the reason for the number of attempts inserted by the person. So here definitely if phlebitis is happening, we can just trace out just by this surveillance form who have inserted the cannula. It's not like they are going to pinpoint the nurse that you are doing a wrong procedure. It's just a sort of corrective and preventive action. So the number of phlebitis and done by the particular person can be screened out, and that particular person can be given a retraining session on the simulation module, and that's why who is inserted is also being recorded in the surveillance chart. And comment about the IV access, whether it was patent, whether there was a good blood flow, whether the backflash phenomena has been occurred. So all these you will be categorizing and you will be writing on the comments about the IV access. And the next one you have IV removal, that is on which date you are removing, why the reason, whether due to phlebitis you are changing the line, or whether the patient is being planned for discharge, or it is any other reason you write it, and who has removed the IV line is also being documented. Then here you can mark the position, just marking by an X, whether it is in the median cubital or might be on the basilic vein or elsewhere, or the femoral vein. All that can be noted just by marking whether right or left and all. Then followed by that you have the monitoring system. So this is actually the day of insertion, the initial techniques what you do, and what and all to be done during insertion is being completely monitored. What about the next following days until the patient is discharged? So there is day of insertion monitoring checklist, Day 1, Day 2, Day 3, Day 4. And it is being done in all the shifts, morning, afternoon and night. You can see there is a small mnemonic, I decide. I stands for identify if an IV is in situ. D, as the patient needs the IV line. E, effective function, whether it is working properly, whether we have done a HEPA flush and lock the line. Complication. C stands for complication at the IV site. I stands for infection prevention. And then infection prevention is like hub decontamination and hand hygiene and all those. Dressing and securement stands for D. E for evaluate and educate a patient. What are the do's and don'ts as well as the family members. And D, document your decision based on the assessment. So continue to monitor, or you're going to do a dressing or securement change, or you're going to remove the IV line. So this is a small vascular access device assessment form where you can have the tracking session just from the day of insertion till the last date where the patient is planned for discharge. So by now I am sure that you are very thorough and on what are the do's and don'ts when the patient is in IV line, or you can call it as the CDC guidelines for prevention and monitoring of peripheral line access. So these are the references which I have done for the IV line access. And once again, thank you so much for your attention and your close concentration throughout the session. Thank you all. Please don't forget to comment if you have any doubts or if you want any other new topics we can discuss together. Thank you.